everyone. I am presenting my paper, Evolution of Punctal Parameters using Anti-segment OCT in patients on anti-glaucoma medications for last 3 years. We all know that topical anti-glaucoma medication are known to cause the lacrimal punctum and canalicular stenosis. In the past, the ultrasonography has been described the punctal imaging, but it gives the poorer images. However, in 2014, Wojcinski et al. Have described that normal punctum and vertical canalicular imaging using anti-segment OCT, which gives high-resolution images, and it's a non-invasive technique. In the studies have been done to create a normative database in the general population for this imaging. So we thought that it can be used to track the changes in the punctum and the vertical canaliculus who have been started on the AGM. The rationale behind our study is that no study has evaluated the changes in anatomy of the lacrimal punctum in the patients who are on AGM. So we plan to do this study because it objectively grades the punctum. So we designed a study with a cross-sectional study, and the 18 patients were included in the both groups. For the inclusion criteria in the case group, all the glaucoma patients who have been instilling at least one topical anti-glaucoma medication for the last 3 years and given the consent for the OCT imaging. For the exclusion, all the patients having previous lid surgery, lacrimal drainage system surgery, any history of the ocular trauma or periocular trauma, underwent the radiation therapy, chemotherapy, having epipolar prior to the treatment of the anti-glaucoma medications, and history of long term of the other medication have been excluded from the other study. In the case group, all the glaucoma patients were included, and in control group, the age, gender matched patients who are not on any ocular medications were included. And all patients underwent the ophthalmological workup and the oculoplasty workup. The anti-segment OCT of lower punctum imaging was done, and the 3 images were acquired by a single technician, and each out of this, the best image was picked by its independent observer. And then the statistical analysis was performed by comparing punctal parameter in the both group using the independent t-test. This is the cross-sectional image of the right punctum, showing that the 3 punctum parameters, the mean punctum parameters like MPD and MPD, VCH, and the MCD. The maximum punctal diameter is the tangential line which join between the junction of the lid margin and the punctum at the upper, and the vertical line drawn from the midway to the lower visual end of the canaliculus, that is the vertical canalicular height, and the midway is the mid-canalicular diameter. Coming to the results, in our results, out of 18 patients, the 7 patients were on the topical beta blockers, 4 patients on the prostaglandins, and 7 patients on the multiple AGMs. In 7 eyes, the grade 1 punctal stenosis was observed, 19 eyes, grade 2 punctal stenosis was observed, and then the 10 eyes were normal in the glaucoma group. However, in the control group, the 33 eyes were normal punctum, and 3 eyes having grade 2 punctal stenosis. This is the table showing the punctal parameters in the glaucoma in the control group. This is the bar diagram showing all the 3 punctal parameters, and you can see that all 3 punctal parameters were reduced in the glaucoma groups, and which are the significant for the vertical canalicular height. And for the maximum punctal diameter, it was a borderline significant. It was not significant for the mid-level canalicular diameter. In the past, the anti-segment OCT studies have been done for the normative database and in the patient of the NLDO. However, no studies has been done to see the punctal and canalicular change in the glaucoma patient. So in this study, we found that the punctal parameter changes in the glaucoma patient that can be picked by anti-segment OCT. And the vertical canalicular height seems to be significantly reduced in the glaucoma group compared to the case group. And the maximum punctal parameter also shows the borderline significant. So there is a need of a future prospective studies in glaucoma patients with an adequate sample size, so that we know that which drugs causing maximum punctal stenosis and in the what duration of time, so that we can plan a timely intervention and plan accordingly. The limitation of our study is that it's a pilot study with a small sample size. Data for the glaucoma patients were collected retrospectively. We can't perform the subgroup analysis for the different anti-glaucoma medication as it was a small sample size, and we all know that the limitation of the anti-segment OCT that is upper punctum imaging is not possible. So I wanted to conclude that anterior segment OCT can be used as a tool in the glaucoma patient for objectively grading of the punctal stenosis and to see the changes of the canaliculus over a period of time, and we can plan accordingly. Thank you.
Any questions? So in this case, your study basically points out that these parameters are worth evaluating.
Sir, in the glaucoma patient, we don't know, these things are also not clear. We don't know which drugs causing maximum punctal stenosis. Like I found the timolol causing, but I don't have that adequate sample size, so I could not say that. And we also don't know what duration of time. So we should, retrospectively, I just did a pilot study to show that we know that it causes the changes, it can be picked up by AS OCT or not, so that we can plan a prospective study to see the changes in the canaliculus.
You can do some more studies, and you can take the preserved and the preserved. There are a lot of companies coming with preserved, non-preserved.
Yeah, that
so
we can do in the prospective study. We can't do in the retrospective study.
Okay.
We compared with the normal group so that the age and gender is also factor that causes the punctal stenosis, so it can be nullified.
Yeah, you did retrospective study. I could not follow. How did you do this? Epiphora also was seen in previously seen cases and glaucoma medications. Then you analyzed, or patient complained of epiphora.
So we not taking
Huh.
anti-glaucoma medications, and excluded the patient on the history that you are having the epiphora prior to the anti-glaucoma medication installation or not. And if the patient is having any active disease like myomitis and all, then we exclude this patient
No,
from
what
the
data was retrospective? And
like
what was prospective in your study?
sir, it's a like cross-sectional study. Retrospective data was like history of the medications, like we ask the patient for what duration you are putting that. That is the. Otherwise, this was a cross. Timolol, sir, beta blocker. And it's the previous study also said that timolol causes more punctal stenosis. And my study was 10 was also toward that. But we don't have the adequate sample size on comment on the basis of the anterior segment OCT to say that.
Okay, thank you.